Musalia Mudavadi. But now, Kenya today joins the rest of the world in marking the 2024 World Malaria Day. Now, the day is celebrated across the world to signify the efforts to end the disease from the root and spread awareness among the people. Now, the theme for this year is accelerate the fight against malaria for a more equitable world. According to the World Health Organization, Kenya had an estimated 5 million malaria cases and over 12,000 deaths reported in 2022. But when we talk about malaria cases, what exactly are we talking about? Now, malaria is a disease that continues to wreak havoc in the country, causing numerous deaths, and World Malaria Day is observed annually on the 25th of April, which is today, to bring global attention to the efforts being put in place in fighting malaria and end the scourge and encourage action to reduce suffering and death from this disease. It is an ongoing concern across the world and especially here in Kenya. And the day was instituted during the World Health Assembly in 2007. This because malaria continues to be a problem the world over. Right now, Kenya, we are grappling with this due to the heavy rains, and malaria is a significant health concern in the country right now. With all the floods and the rain, malaria cases are expected to flare up. And what are we doing with regard to that today being the World Malaria Day? What are we putting in place? What measures are we putting in place to make sure that the population is actually protected from malaria? And the prevalence of malaria is endemic in Kenya. That means malaria is constantly in the country all year round. It is a concern. There is no day in the country that you would say malaria is not there. It is endemic. It is always there. We are always facing the problem and the issues that come about with malaria. And the coastal areas and regions with high rainfall have higher prevalence rates. Now, talk about Mombasa, talk about Kisumu and other areas that have lakes, have rivers and places with more rainfall. Nairobi, as we speak right now, the rains are pounding hard, not only in Nairobi, but across the country. The floods that we are witnessing. Proper breeding grounds for mosquitoes, Anopheles mosquitoes that cause malaria. And Kenya experiences high incidences of malaria cases annually. This continues to be seen as the numbers continue to go up. Also, the resistances that continue to be experienced due to how we are taking our medication, what we are doing, are we taking care of our spaces, are you clearing your compound of the stagnant water? All those continue to increase on this number. And the incidences peak during the rainy seasons when mosquitoes breeding is most prevalent. We've mentioned that with the rains, the stagnant water in our homes, the rivers that we have, the trenches that we have that keep on storing this water just stagnant. Proper breeding grounds for malaria. And the mortality, malaria is leading cause of death in the country. If you did not know, now you know. Malaria is killing more Kenyans than even the road accidents, according to NTSA reports that they gave us. Malaria is actually topping that number, and children under the age of 5 and pregnant women are mostly affected. If you are a parent, your children is there, do you have your wife is pregnant, they are highly susceptible to being affected by malaria, probably about time that you took measures on that regard. And what are some of the efforts being put in place to address and fight the scourge that we have now? The government, together with various international organizations and NGOs, have implemented several strategies to combat the scourge that is malaria. That includes distribution of insecticides, treated bed nets. This is one of the ways that have proven to work over the years. Bed nets that are treated have been given especially to these communities, these demographies that continue to experience increased numbers of malaria. And the indoor residual spraying as well, both indoor and outside, spraying of insecticides to kill the insect, that is mosquitoes, and provision of anti-malarial drugs. This continues to be there in our health institutions. It is a method that continues to work. It has worked for I had malaria. These worked for me. And community education on preventative measures. Now, what are some of the preventative measures? This includes clearing all the stagnant water that you have, making sure that you spray inside, getting treated mosquito nets, and using them in the correct manner. Because some of us are actually given these mosquito nets, but we end up using them to fence and for our chicken or our garden shambas. I mean, use the mosquito-treated nets the best way that they are supposed to be used for you to get maximum results when it comes to protecting yourself. And now the challenges that we continue to experience is drug resistance. Because we don't use these drugs, we don't consume drugs as prescribed by the doctors, we develop drug resistance, we develop immunity. Malaria becomes a problem. You find that every other year, researchers and pharmacists have to find new drugs that would be able to deal with these mosquitoes. And also the mosquitoes themselves over years have developed resistance against the pyrethrums that we use, against all these chemicals that we use in fighting them. Therefore, it is a constant battle trying to find what will work best for you and I. And inadequate healthcare infrastructure in remote areas, this is a constant worry, a constant concern, and we call upon the county and the national government to put in place proper infrastructure for us to be able to deal with malaria in our specific demographies and across the country. Because as we said, malaria is endemic to the country. It is there all year round. Therefore, they need to have proper infrastructure that will give us proper means, easier ways of fighting malaria. And limited access to healthcare services. As we speak right now, doctors are not in hospital. That means that you and I accessing healthcare is a problem. That has continued to be there, including even when the doctors themselves are working. And the fact that now doctors are not working, it's even worse because remember, it is raining heavily. Mosquitoes are about to start to be produced in numbers. We don't have access to health facilities. Doctors are not there. Who is taking care of us when this disaster continues to strike? Because remember, it is endemic. Doctors not in hospital. The government do something about it. And now, as temperatures rise globally, this with regard to malaria and climate change. As temperatures rise globally, the impact of climate change, the transmission of the vector-borne disease such as malaria becomes increasingly evident. This continues to be a concern the world over because areas that on normal days have not had malaria being reported in those areas are now reporting malaria cases because of climate change. Areas that were predominantly cold are now warm, good environment